So hi guys, I thought of doing this as a live video so that you will be able to watch, and those who want, and I'll just share the same on my page. So this is special for parents who have children, or who are parenting, or who, for one way or another, they have their younger one who's actually on the spectrum. This video is specifically for them. And today we're going to talk about Leucovorin and autism spectrum disorder. Why this video? It's because I've been asked by two parents, and I thought, okay, maybe I should be able to answer this. So what is leucovorin? Leucovorin is another name for leucovorin is folinic acid. It's the active form of folic acid, yeah. And usually folic acid is a vitamin. It's actually a type of vitamin B, and we usually use vitamin B vitamin B is like the fuel for our body, and also it helps in the fueling for our body, like in the making of the energy, and also it also helps in the development of the brain, okay, and the spine. And it's usually one of the reasons why anytime you have a lady who's pregnant, that one of the vitamins that are actually given in those first 3 months, very crucial, is usually folic acid. So that's why we insist on folic acid supplement. The primary function of folic acid in the first 3 months is usually for the brain development, and also what we call the spine. So if for any reason a mom is deficient, what will happen is they are going to have what we call neurotube defects, which usually presentation happens with a child born with a very big head. We call it hydrocephalus. That means there's water in the brain, in the skull, more than you'd expect it to be. So the brain development is hindered, and also the way the spine develops is also different. So you find they may have a wound along the spinal cord somewhere, and sometimes that can affect even them being paralyzed. Yeah, you find a child born paralyzed, or a child born and they are not able to control their bowels, okay, because of, depending on how high it is and the kind of nerves that have been involved. So leucovorin and autism spectrum disorder came into limelight, I think, February this year. And what happened is, I think the Daily Mail, which is usually a paper in the US, published that there was a child who took leucovorin and they were able to speak. These were children this child was on the spectrum, and when they took leucovorin, they were able to start speaking. They were nonverbal. Okay, so immediately after taking leucovorin, I think in a span of 1 or 2 weeks, then they were able to speak. And of course the parents were very excited, and of course, that's something like that, of course, will make news. And that's really what made people to now all start saying, okay, should we be taking leucovorin for our children who are nonverbal or not? Now, based on how leucovorin works, as I told you, I'll be using folinic acid. I think it's an easier name for my pronunciation. Based on how folinic acid works, usually folinic acid is the most active form of folic acid. So when you take folic acid, it has to be converted to folinic acid for it to be able to work. So for that conversion to work, it means there's something called receptors in our brain, okay? So it means if these receptors are not working, if you take folic acid, it will not be able to access the brain without it being without it being in the most active form. So you find what has been shown is our children on the spectrum actually have antibodies. Antibodies are things that fight. And so what has been shown, most people, like the general population, will have antibodies that fight these receptors in the brain, and usually around at a ratio of between 10 and 15%, they will have these antibodies. But for those on the spectrum, up to 70% of these children actually have antibodies that fight receptors for folic acid. Okay, so what is happening is, yes, children are taking folic acid, but we are not sure how much of it actually getting access for it to actually function in the brain. So what leucovorin is, because it's a folinic acid, it's an active form. It doesn't need to go through the receptor. It goes through other means to be able to access the brain. Okay, now should all the children on the spectrum who are nonverbal be able to take folinic acid? The answer is no. It's actually a strong no. Number one, we do not have strong trials that have actually confirmed that all children who are nonverbal and they are on the spectrum, they should actually now start be taking leucovorin. Okay, we do not have that. However, what has been shown, hi KP, what has been shown is, if for any reason you have a child on the spectrum and they are nonverbal, before considering leucovorin, what you need to do is confirm if your child actually has antibodies that are against the folic acid. Okay, this is a test that you can do. I'm yet to know how easy it is for it to be actually be done here in Kenya, but I think it can be, even if it's not done locally. I'm sure you can draw samples and they can be done from, you know, somewhere else, and then you can get the results. I'm yet to get such, maybe it's something I can check, and then maybe I'll be able to share it. But if before you think of giving your child, if you have a child who's nonverbal and they're on the spectrum and you really want to explore that's the path I really recommend. That check first of all if they actually have antibodies against these receptors for folic acid. Okay, if for any reason they do, then you may be a candidate who will be able to benefit from leucovorin. Okay, but what I would discourage you is just doing it blindly because it has helped other people. Okay, why? Because leucovorin is not how do I put it, it's not food. It's not like a fruit that you're taking. Okay, so it has its own side effects. Okay, so I would highly recommend before you going to purchase, because it is easily available, because it's actually used by cancer patients as a way of being able to replace the folic acid. Okay, so it's actually easily available. It's something you can actually buy, or your doctor can actually prescribe. But what I can tell you is, do not go and buy for your child leucovorin if you are not sure if they actually have the antibodies. Okay, so that's what I can say, because I think I've had, as I told you, I have had two parents who have asked me, should I buy because my child is nonverbal? And I totally understand the frustration, by the way. I totally do. However, sometimes when you're too desperate, you are at risk of doing more harm than good to your child in that space of actually seeking and, you know, chasing what is the next thing. Okay, so yeah, so I really hope that helps. Thank you so much. I can see Mukami Pravalikachu. Okay, I really hope that's how you pronounce your name. I'm really sorry if I've butchered your name. Miss Gino Koimorin, KP Motors, thank you. Becca, hi, how are you? It's been a minute. Chemumu Mushi, Ojio Tuga, Dr. Eli Mokono, MD, Marcy Cherono, thank you. I've seen all of you guys and I truly appreciate. And so yeah, so if you know of any parent of a child on the spectrum, please, especially if they are nonverbal, this is something you'd want to share with them, and I'll truly appreciate. Thank you, Becca. Major hugs to you too. Yeah, so till then, I don't know if you guys have any question before I close. Yeah, do you guys have any question? I'd be more than happy to answer. Any question? None? Okay. So yeah, so thank you guys for sticking around, and yeah, please share this to as many parents on the spectrum as possible. And yeah, if you have any other question, please go ahead and ask me, and I'll surely more than glad be able to answer you. Till then, bye.